Tonight, we're following through on a story we brought you back in May. Mothers and babies in Florida are dying at an alarming rate, and the numbers are significantly worse for minorities. But a new report says there are three major fixes to the problem that Florida could take on to turn around those numbers. ABC Action News in-depth reporter Rochelle Helene has that story.
When it comes to health outcomes for moms and babies in Florida, the numbers aren't great. According to this report, between 2013 and 2017, our state ranked 32nd for the highest maternal mortality rates. And data shows that if mom and baby are black or brown, the outcomes are even worse. But Friday, a researcher who helped craft this report told us that there are a few big ways that Florida could turn those numbers around. First up is by expanding the state's Medicaid program. The idea is that if you have access to covered health care and are healthier before, during, and after pregnancy, you and baby generally will have better outcomes.
If they did, they would increase coverage for a lot of individuals who currently fall into what we call the coverage gap.
That research team says Florida can also do a better job of educating people about the Medicaid Family Planning Waiver Program. It allows people who don't qualify for Medicaid to still access things like sex education, STI testing and treatment, health screenings, and other family planning services.
We see individuals who would be eligible who are not applying. And then we also see that even when individuals do enroll into these services, that they actually don't use the services.
Lastly, researchers say we need to make it easier for folks to access midwives and doulas, especially for those who don't need much medical intervention during birth.
We actually see that midwives provide care that is equivalent in terms of its efficacy, and then in terms of its safety, they actually have a safer profile, and that's with the caveat that midwives are really important for low-risk pregnancies.
In addition to providing education, a leader who helped oversee this project says this data will also be used by a maternal health coalition to help lobby for change.
And there's a very active coalition that's going to be moving forward on advocacy coming out of the research.
In Tampa, Rochelle Helene, ABC Action News.